One of the most commonly asked questions by patients on YouTube across social media is what is going on with the blood pressure tanking after surgery? So you got to remember, very first thing is that the body is always trying to maintain balance. It always wants to keep your temperature, your blood pressure, your heart rate within a narrow range. But if you have ever had the symptoms of dizziness, maybe loss of consciousness, nausea or vomiting, and then more serious things like kidney injury or delirium, stroke, these may have been the cause of your body not being able to maintain its balance of blood pressure, what we call perioperative hypotension. There are three main causes, and I give them convenient M words. That's meds, muscle, and the mess of the operating room. So we're going to go through each one of them, and the live Q&A will be at the end, and I suspect Karma will, oh, she keeps booping me here. She just wants to say hi. Let me give Karma a quick little shout out here, and then we'll get started. Say hi to everyone, Karma. Woo-hoo. Yeah, so not interested in the camera. All right. Well, very good. The first one is medications. And to understand how medications cause the perioperative hypotension, you need to understand that your blood pressure right now, as you're listening to this, is governed by two factors. And one of them is called vascular resistance, meaning how constricted or dilated your blood vessels are. The more constricted the blood vessels are, typically the higher the blood pressure. And the more relaxed the muscles in the blood vessels are, and the more dilated they become, the lower the blood pressure. If you understand that, everything else makes sense, because medications like propofol, the white stuff, doesn't just cause amnesia and unconsciousness and cause you to stop breathing like in the Michael Jackson case, it also dilates your blood vessels. The inhalational gases and even spinal anesthetics like lidocaine, when injected near the spinal cord, all cause massive vasodilation. And the exceptions are, oh, Amando came back up on the table here. All right. You can actually see him in the bottom corner. Here, let me take this away. You see this little cat? You'll see the little tail here. So the exceptions are ketamine, etomidate. What the heck just happened? Get off of this cat. Dude, get off. What happened to my screen? Sorry, that was the cat being a cat. The exceptions, ketamine, nitrous oxide, also known as laughing gas, opioids, benzodiazepines. These don't tend to decrease the vascular resistance, meaning they do not dilate the blood vessels. The problem is that you can't be under general anesthesia just with nitrous oxide or opioids or benzodiazepines. With ketamine, we really don't do that either because of the risk of all sorts of adverse psychiatric effects. So if you're going to be under general anesthesia, you typically have propofol or gases, and they can cause that decreased vascular resistance. Now, we said as your blood vessels dilate, the blood pressure goes down. Now, the problem on top of the blood vessels is that the medications that we give also weaken the heart muscle strength, meaning that on top of your vessels being dilated, now your heart is also not pumping with the same strength. So when you pair together the decrease in that vascular resistance, which refers to how much resistance those blood vessels have to blood flow going through them, right? The tighter they get, the harder it is for blood to go through, and therefore we say the resistance is higher. The more dilated they get, the easier it is for blood to go through, the lower the resistance. You pair that with the decreased heart pump function, and you can get serious low blood pressure. So if you have ever had low blood pressure after surgery, if you're one of the thousands of people who's asked me, I'm curious for you to tell me below in the comments which of these three causes it was. But remember, this is just number one. This is meds and how it affects those parameters of blood pressure. Because number two is the muscle. And the heart muscle and the blood vessel muscle are both involved here. Karma is still booping me down here. And I wish you could see her. She's adorable. It's just these eyes. So interested in perioperative hypotension, clearly. The issue with the heart muscle during surgery is that several things can compromise your heart's ability to beat when you're under anesthesia having surgery. Now, the biggest fear is always ischemia. That stands for not enough oxygen reaching the heart muscle, which means something leading to a heart attack. So ischemia is like the precursor to a heart attack. And if you have a heart attack, your heart simply cannot beat. This can happen under anesthesia. And the problem, as you know, is that you're not awake to say, oh, doctor, my chest is hurting. I'm having chest pain. If you don't tell us you're having chest pain, how do we know you're having a heart attack? Right? The only sign, or at least one of the only signs, might be a low blood pressure. Next are arrhythmias. And this is things like atrial fibrillation, or maybe such a fast tachycardia that your heart is unable to actually sufficiently squeeze enough blood out to generate enough blood pressure. And then you can have things like pneumothorax, which means that there is air that enters. Whoa, cat. Sorry, guys. Mando is determined to ruin our live stream today. Cat, get off of here. Oh my gosh, get off. How did you even get up there? One last look at this. This is a trouble. You know what? If I hold him here, he can't cause trouble on the desk. So we'll just do this. A pneumothorax occurs when there is air in your chest, but not in your lungs. And that air can expand to actually squeeze your heart down to prevent it from pumping properly. So it can be very dangerous, a pneumothorax. Then you can have pulmonary embolism, which means that a blood clot that formed maybe during surgery, which can absolutely happen because you're not moving your legs when you're under anesthesia. If that blood clot in your legs shoots up to your lungs, it can cause a lethal blood clot, what we call a pulmonary embolism. And that can also prevent your heart from pumping blood out because it's stuck against a giant blood clot. And then lastly, I put tamponade, which means that if there's blood that forms around the heart that prevents the heart from beating because it is constricted by the blood, that can also prevent the heart muscle from doing its job. And that can be lethal. And once again, you can't tell us that your chest is hurting. You can't tell us that you're feeling winded or fatigued, which if you're awake and you have these symptoms or you have one of these conditions, you'd be able to tell us because you're under general anesthesia. So we sometimes only can tell off of the EKG and the blood pressure monitor. That's why the monitoring is so important during anesthesia when you're having surgery. Okay. The next muscle is the blood vessel muscle. If your blood vessel muscles get paralyzed, we call it vasoplegia. Vaso referring to the vessel, plegia referring to paralysis. Did you know you have a ton of muscles in your blood vessels? And those, I'm trying, guys. I'm really trying. If those muscles in your blood vessels get paralyzed, they will widen up. This is independent of the anesthesia effects itself. I told you propofol and anesthesia gases will dilate your blood vessels, but other things in surgery can also cause them to go into vasoplegia. These paralyzed blood vessels. In addition to the medications we talked about, any inflammation that happens, which, by the way, surgery is just massive unregulated chaos. Sometimes we hope it's regulated when we're doing it, but sometimes things go out of hand and there can be a systemic, a body-wide inflammatory response that will... The cat is wreaking havoc all over my desk. That systemic or that body-wide inflammation will cause vasoplegia, paralyzing your blood vessels, causing them to widen. And remember, anytime you get cut with that surgery scalpel, you have an inflammatory response that's going on. Now, blood transfusions can also contribute. Organ transplantation, same thing. Severe infections, like if you have sepsis, which we'll talk about in a second, you have sepsis, that can also cause a whole wide array of endotoxins to be released. You can still be sick with an infection under anesthesia, right? You can have sepsis from, for example, a very bad appendicitis, a bad infection in your colon, all sorts of places where an infection can manifest under anesthesia. On top of the effects of the medications, now you have sepsis or a serious infection that's also causing vasoplegia. And then I ended with cardiopulmonary bypass. That is also a known, when you take your body's blood and take it outside the body to go through a heart-lung machine, you cause your blood vessels to get paralyzed very quickly. We have to give specific medications in those cases to force the blood vessels to constrict again Things like methylene blue, maybe you've heard of that in the wellness sector. It's actually used in the operating room. There's more than just septic shock, which can cause vasoplegia. And you got to know that there's anaphylactic shock, or that allergic response that you know about, why people carry the EpiPens with them. Well, even if you're not in surgery, and if you have those mussels or the shellfish or the peanuts or whatever you might have an anaphylactic reaction to, your body undergoes a massive vasoplegia, which causes your blood vessels to dilate, severe low blood pressure. And then you have neurogenic shock. That is when the nerves themselves are being affected so heavily that they just kind of turn off. Like, imagine you have a stroke, but instead of you not being able to move your arm from the stroke, your blood vessels cannot move because of a little mini stroke. These are typically reversible, meaning that, for example, we give the spinal anesthetic near your spinal cord root nerves. That paralyzes the nerves, but it wears off within usually an hour or so, and then they tighten up again. So that's neurogenic shock. Now, before we go on to number 3, just as a quick shout out here, if you're learning something new, share what you are learning with others, and please hit that like button to subscribe or to keep up with all of the live streams that I do to answer your questions. And remember that you can always join the exclusive access group. The link is below, where you can access our private streams over Zoom to ask your personalized questions. We'll answer as many as we can here at the end in just a couple minutes, but that's where you can ask more private questions in a much smaller setting. Number 3 is what I call the operating room mess. So we had meds, we had the muscle, we have the mess of the operating room, which, let's be honest, can be pretty bloody. If you have a bloody mess in the operating room, your blood volume shrinks because you've bled out the volume of blood circulating in your body. I think I said bloody at first there. So if you have dehydration because you come into the operating room already fasting, right? We ask you not to eat or drink for hours before surgery. So you're coming in potentially dehydrated. Maybe it's hard to even get that IV because they're all shrunken down because you're dehydrated, like a little prune. And then you bleed out the precious blood supply that you have. Well, now you have extra more reasons to go hypotensive or to have low blood pressure. Well, how do you treat any of these 3 causes? Well, you got to treat the underlying cause, and when possible, prevent the issues from happening in the first place. And yes, you can prevent so many of these from happening. By the way, I just realized there's a whole bunch of cat hair still on my shirt here. Do you see that? This Maine Coon is just like a ball of giant fur. Wow. Oh my goodness, it's a lot of fur. So you treat the underlying cause firstly. So if it is myocardial ischemia, you need to give agents to help support the heart to rebalance its oxygen supply and demand. That is how we treat any form of heart attack. Typically, it's related to coronary artery blood pressure, not plaques that explode like outside the operating room. Anyways, it's a big topic, but that's the general overview. If it's a pneumothorax, you need to put a needle in the chest right away to suck all the air out that is otherwise compressing the heart. If it's a cardiac tamponade, you have to extract the blood that is constricting the heart outside the heart that's keeping it tamponaded. You know, like the word tampon? It's the same word, cardiac tamponade, right? A tampon that people put downstairs is to help push out and minimize bleeding, or at least to absorb the stuff, right? Well, if you have tamponade, that idea of pushing is what happens to the heart, where it's actually pushing in on the heart in this case, preventing the heart from beating. So same word, interesting, same root. 2 totally different body parts, as you can tell. And then there's the question of what do you do for someone who's bleeding out? You give them a blood transfusion. If they're low on their blood volume because they're fasting, you might give them more fluids. You might place a second IV to give more fluids even faster. If they're having vasoplegia, you give medications, like I said, methylene blue, to force the nerves to contract again. Maybe you give epinephrine. Maybe you give phenylephrine, norepinephrine. You give medications that will forcibly cause those blood vessels to constrict. Because remember, your body is always trying to heal itself. This is the fundamental premise of integrative medicine. Western medicine and Eastern medicine, we all believe the body's trying to keep its bodily functions aligned, but anesthesia and surgery are just throwing it off its axis constantly. So that's why we need to intervene until the body is able to regain its composure once these medications wear off, once the shock is resolved, etc. It might be minutes, it might be hours after surgery, it might be days in some cases. But the idea is that your blood pressure, your dizziness, your delirium, etc., should hopefully be minimized if we can keep your blood pressure in the right place. And you being honest with your doctor, like telling us any heart problems you may have, is critical for us to know up front. Many people forget, unfortunately, to tell me about, oh, yeah, I did have a heart attack 10 years ago. That's important information we should know. Or, yeah, I did use some drugs the other day. Oh, well, that might also cause vasoplegia or cause a hypertensive or hypotensive crisis. These are all things that you got to tell your doctor so we can prevent these bad things from happening. Sorry, my allergies are really bad here, but it's not to the dog and cat, it's the stuff outside. But I forget who said this. Oh, it was Einstein. He said, the clever man solves problems. The wise man, or whatever, wise person, prevents problems. We can prevent these problems and these terrible side effects if you tell us up front about your body and your habits. And please don't be afraid of social habits or whatever. It's actually very important for us to know, and we don't judge you. Much better than having a bad outcome after surgery. So let's jump into the Q&A. So many awesome comments coming in here. Hey, Mel, I recently donated a kidney. I take opioid prescribed by a pain management doctor. After surgery, my pain couldn't be controlled. BP was very low. They wouldn't give me additional meds. My BP. I'm so sorry. Pain medications typically don't lower blood pressure. It's a common misunderstanding. Opioids do not reduce blood pressure, with very, very few exceptions. But if someone has high blood pressure because of the pain, giving the opioids will reduce the blood pressure from there. I'm so grateful that you donated that kidney. That's really incredible. And I hope that your pain has resolved since. And Caitlin also feels the allergies. Can we just be nice? Yes, I think we should all be nice here and learn in a respectful way. And Mama Bear, I agree, it's true. I don't know what you're referring to specifically, but truth, I like it. I'm happy that you're learning something new, Lauren. Just as a reminder, if you did learn something new, please hit that like button and subscribe to keep up with all my lives and share what you learned with others. Jean says that I was afraid I was having some heart issues because I experienced edema in my legs. My friend has a service dog for heart problems, and he would have alerted if I was having. Well, Jean, that is a very good thought. Now, you cannot depend on another person's service dog to determine if you have a heart problem, because we don't know what specific heart problems that service dog is trained for. There are many types of heart problems. Arrhythmias that can lead to congestive heart failure, heart attacks that can lead to congestive heart failure. I mean, there's so many conditions, and the dog might not be trained in all of them. So you do need to talk to your doctor. I would not rely on that alone. But it's cool that your friend has a service dog. Karma here is not a service dog fully yet. Rafi, so good to see you. I'm so happy that you found it interesting. And yeah, I agree, Maureen. Dogs are pretty awesome. We've been lied to by doctors about pain and payment. Well, hey, I empathize with you on this. I have a whole video on the opioid pendulum and why things have gone so out of control in terms of how we prescribe pain medications. And it is very unfortunate because patients that need pain meds are deprived of them, all because of several bad actors that have really taken advantage of the medical system. My heart goes out to you. I am very sorry. Laura, every time I have surgery, they won't give me pain meds after because they say my blood pressure is too low. Yeah, that's a weird one, right? Like I said, if your blood pressure is only maintaining where it is because of your sympathetic drive because you are in pain, adding additional blood pressure medications will lower it because you've now masked the sympathetic, or now if you will, remove the sympathetic stimulation. But it's not a reason to keep someone in pain. You had to figure out what are the other causes that the person might be hypotensive. Very weird, right? Lauren Watson, that's why I'm bringing up this topic, because it's so important for us to know that there are many causes to low blood pressure. Pain artificially driving up the blood pressure is not a reason to withhold pain medications. My heart goes out to you. This is just horribly not appropriate. Now, maybe there's more to the story that you weren't told, but if that alone is the story, not good medicine. Diana, should a person having knee replacement that is 80 pounds overweight have anesthesia? Well, but ask your doctor about that. Depends on where the white is, what effect it's having. Is it in the presence of diabetes, hypertension, etc., and how well controlled those other comorbidities are. Can I please post the Zoom link? It should be in the comments below to join the exclusive access, to gain access to those Zoom links. Judy, I would love to bring in the animals more often. Mochi has run off somewhere, but we'll bring Mochi in next time as well. And I'm with you, Maureen, on this. How it's just how bizarre of a explanation it is to not give pain medication to someone because they have low blood pressure. No, you fix the blood pressure and you give the pain medications. Maybe they need more fluids. Maybe they need a temporary vasopressor. You don't leave them in pain. What is your view on donors do this 3 to 6 times a year? I have nothing against that. That's fantastic to be able to have health, to donate blood to others. We certainly need more individuals like that. Thank you so much for putting that link there, Heidi. I appreciate it. And you are very, very welcome. And thank you to Show Life Youngs. So the low blood pressure, the reason doctors wouldn't let me stand right away after my procedure. So there are multiple things that can contribute to you being dizzy after surgery. Low blood pressure is one of them, but also the psychoactive effects of the anesthesia. If you're wobbly on your feet, you are what we call a fall risk. The last thing anyone wants is for you to have a successful procedure and then stand up too quickly and fall and get a brain bleed because you were not steady on your feet. Excuse me. Sorry about that, guys. My goodness, what is oh, well, thank you so much, Barry. Now POTS will also contribute. Oh my gosh, I'm so sorry about my nose here. POTS will can have a variable effect under anesthesia. I have seen some people's POTS not be an issue at all. I've seen other people's POTS be a significant issue. Typically, the autonomic dysfunction of POTS, when you add that to anesthesia, where we're kind of wiping out your autonomic nervous system anyways, almost like they cancel each other out. There's a lot of variability in reasons for POTS. But because we are monitoring things so closely in the operating room, we treat things very quickly. And POTS is typically not an issue during surgery, but after surgery, of course, can be an exacerbating factor. Receiving blood affects us in many ways, Jody. But with regards to hypotension, if there's a low degree of inflammation or a low-grade allergic reaction, that can absolutely lower the blood pressure, which is germane to our conversation here. Of course, fevers, etc., that we would treat with acetaminophen or paracetamol if you're outside the United States, or what we call Tylenol here, is one of the mainstays to reducing that fever. Usually there is no antidote to a minor blood reaction, but just kind of riding it out with supportive care. Why does my BP skyrocket only at night? I do not know without knowing more information about you, but nocturnal hypertension is a significant risk factor for heart disease, so it has to be addressed. Yes, thinking happiness, I love that message. Now, Heidi says they stopped my pain meds and quick gave me pain. So nerve blocks are great because they will not affect your blood pressure unless we're talking about something that's like an epidural. Epidurals will lower your blood pressure through that neurogenic shock-like component that I mentioned earlier. But nerve blocks in your arms and your legs, around your abdomen, are not going to do that, which is why there's such powerful tools. There's no excuse for not giving a nerve block with regards to hypotension. Heather, so good to see you. So good to see you. Good afternoon, Emily. So here's a question from Susan. When the surgeon uses CO2 gas inside the patient's stomach, it's not the stomach, it's inside the abdominal cavity or the peritoneum, but I know what you mean. Doesn't that damage the organs? So it can damage organs if the pressure is so high that it prevents blood flow to the organs. But this is why we're very careful monitoring the pressure of the carbon dioxide inside the peritoneal cavity to make sure that it is not higher than the blood pressure, because if the pressure from the insufflation of the CO2 is higher than the blood pressure, you're going to shut all those blood vessels and then your organs will die. I don't want to sound dramatic, but that's why we monitor it very carefully. Katie, the sugar levels raising after surgery, is that a common thing? Absolutely. It is because of the stress response, the inflammatory response we're talking about that increases insulin resistance. Super common, happens all the time. And that sounds like a great idea for a video if other people want to know about that as well. What exactly is hypertension? It is when your blood pressure is above a systolic of 140. That is one of the most agreed upon definitions. Sometimes we say over 130. Essentially, it just means high blood pressure. Um, and the emo surf. So sometimes if there is a severe hypotensive crisis, we will put the blood pressure cuff in what's called stat mode, meaning that it is just cycling constantly, literally every couple of seconds, so we can get rapid fire blood pressure measurements. We usually reserve that for emergency situations when there is not an arterial line, but it can certainly be uncomfortable. Usually you are not conscious if your blood pressure is that low that we're going into stat mode. You're welcome, Susan. They put CO2 in the abdomen, like Susan was saying, to insufflate it. So when they put the camera in there, they can actually see what's going on. Because otherwise, if there's no air in your abdominal cavity, everything is shut tight. You can't look around for the appendix. You can't look around for whatever other organs you're trying to fix, your small intestine, your large intestine, etc. That's why we have to insufflate it with air. Bia had a knee replacement 5 weeks ago. The nerve block worked great. I'm happy to hear about your positive recovery. I hope you can help advocate for others to be comfortable with the nerve block. RDNAC, that nerve block, I have a whole series of videos on it. I recommend you look at them because it's too big of a topic for right now, but they can be very safe when used appropriately and can really help comfort after surgery, like we saw a moment ago. Jacqueline, I have 4 surgeries. Each time I came to itching really bad. It could be from the anesthesia. It could be from maybe the cleaning solution they put on your skin. That can be irritating sometimes. There are no shortage of reasons to be itchy after surgery, but it's helpful that propofol actually has an anti-itching effect to it. So be sure to tell your surgery or your surgeon or your anesthesiologist in the future if you had really bad itching after, so we can help either identify the culprit irritating medication, maybe it was an allergy, or if there was a topical thing put on, like an antibacterial cleansing agent. What is gas go in the abdomen? Oh, hurt the shoulder. All right, we'll end with this question, PJ. Such a good question. Did you know that when your diaphragm gets irritated, it affects the same nerves that go to your shoulder area? So we call it referred pain. So after gallbladder removals with that gas in the stomach or appendix removals, etc., the shoulder hurts, even though there was no surgery up here. But because the nerve that goes to the diaphragm, and the diaphragm gets pushed and gets contorted from all that gas underneath it, that tricks your brain, and it sends a signal that to your brain thinking that it's your shoulder that hurts, whereas really it's a diaphragm that has been irritated. Isn't that weird? It's called referred pain. Super, super weird. Well, Mel, I'm happy that's incredible that you did a kidney donation. I'm sorry that you had that effect. I will just end with this here. I said it at end with the other one earlier, but anything about anxiety, I have to acknowledge. Preoperative anxiety is huge. I have many videos on this. We can't ignore it because it has very real effects during the surgery and even after the surgery, and for the recovery for the weeks and months to come. So I really hope that you are able to maybe take advantage of my videos or speak with your doctor about how to reduce anxiety before surgery. And the phrenic nerve is exactly it, just me. You got it. We believe it is due to the phrenic nerve causing that referred pain. Very curious phenomena, but I see that we're not the only one here because Mama Bear also had that. Yep, exactly. Hey, well, thank you so much, Rafi. That is fantastic. And the pain meds, yes. I keep saying last comment, but these are such good points. Lauren, pain meds, especially in the opioid family, are well known to make us itchy. Morphine is one of the most common ones. And Benadryl can help as well. It's just easier to give a non-itchy pain medication. of which there are many. Anyways, I hope you all have a great rest of the weekend. Remember that you have more power over your health than you've ever been told. Thank you so much, Heidi, for all the kind comments. And Jamila, Thinking Happiness, Tina, uh, the show Life Youngs. I love it. Mel, you guys are awesome. Have a good rest of the weekend. Until next time. Oh, I would bring the cat to say bye, but I don't know where the cat went. Quite frankly, there's enough hair all over my thing right now, so I won't bring the cat on. But you saw him earlier.